Well, I had my second stent placed May 3rd of this year, 2019, and I'm 57, and I've got a family history of cardiovascular disease.
So on this video, we were seeing a patient yesterday, and we got through with we were about halfway through the meeting, and he said to us, his name is Dan, by the way, and he said, "Doc, I feel so much better. I felt like I wasn't entirely sure what was going on with some of my health risks before. Now I feel a lot better. I feel like we've uncovered a lot of interesting things, a lot of things that not only have we uncovered, now I feel like I've dialed them in and I know what to do. And physically, I'm feeling better as well." Maybe that's a good start to or a segue back into the topic for today. You want to take it from here?
Sure. Well, I had my second stent placed May 3rd of this year, 2019. And I'm 57, and I've got a family history of cardiovascular disease. And I was really feeling physically and mentally kind of beat down because traditionally, I'm tall and thin. I'm about 6'6". I weigh about 195 pounds, so I wasn't a really good candidate for a stent, I don't think, from the physical appearance on the outside. However, after the second stent, I just felt maybe a little mentally defeated, a little bit weak physically, and consequently, through the recommendations of a collaborative effort of you, Dr. Brewer, Dr. Wright, my cardiologist, and my family doctor, started out on the cardiac rehab process, and also some meetings with you and Dr. Wright. And it was really, really neat. It was just a transformation or a metamorphosis similar to that of maybe a caterpillar evolving into a butterfly. I really started to feel stronger. I felt a higher capacity for my desire to work out and to do a lot of cardio work. And my eating habits were always the same. And man, I just started feeling stronger. I felt better mentally. I was having better success at work, and it just was a great pivot in my life. And I feel like I think I might have told you and Dr. Wright yesterday that I kind of feel indestructible, if that's not too boasting to say. But everything really came together when I started to work with you gentlemen. And you guys just pointed me in the right direction. I just feel wonderful. I feel indebted to you guys, and I wanted to share my story with those who may get some benefit from it.
Well, I do appreciate that. Any highlights on any of the challenges that you had, and focus points on how to get through those?
I think it was really, a lot of it was just how I felt in my mindset. The mindset can be a really wonderful thing, or it can be a tragic thing. If your mindset is pointing down and you're feeling beaten and defeated, it's easy to gain momentum in a negative fashion. But of course, on the flip side, when your mindset is raised and you're highly optimistic, man, once you get momentum going in a favorable direction, it's just outstanding, and there's really no limits to what you can do. So you guys have put me there. You put me there. Just my general vitality in life, my zest for exercising and working out. I've got a nice home gym with a treadmill, a set of dumbbells, a little weight machine, and just recently bought an elliptical trainer. So I was real tentative after my stent that I wouldn't be able to use all that equipment again. But man, I'm rocking and rolling now.
You've actually brought up a couple of really good points. The first one that you brought up was that you're tall and thin. And yes, I will admit, very few patients coming to me with challenges are tall and thin. I get a lot of patients that have had a lot of weight in the past. And in fact, over half of my patients coming in now, I'll start working with them and realize fairly quickly after going through their labs and their imaging that recently lost 30 pounds. Last week, somebody had lost 95 pounds over the past year. And the week before that, someone had lost 130. But you're very different. In many ways, you remind me of me. Most people just make an assumption that, well, if you're thin, you're going to be healthy and not have any heart attack and stroke risk.
True.
But obviously, given what you told us coming out of the blocks, you just went through your second stent. So that's not always the case. Another significant difference with you is that not only are you tall and thin now, it's not that you've lost 30 pounds recently or 100 pounds or anything like that. You've always been tall and thin, right?
Yes, I've had about a 10 to 12 pound variance since college.
Yeah.
So, yeah, always been the same.
So you're living, walking proof that it's not just BMI alone. There's some other things too. And sure enough, as we started digging a little bit deeper, we did find some things. We were able to make some adjustments, and then we came to that second place, which you just brought up at the end of your story, and that is having recently had my second stent. I was very nervous about using this new equipment, exercise equipment. I can share that with you as well. That I remember after my first episode of finding that I had significant plaque, going out to do my next long run. And at that point in time, I was doing these half marathon training runs once a week. So you take off, but if something happens to you when you're out there, it's going to be a while before you're discovered. And it's a little bit of an emotional component to get back on the horse after you first find out that you have some of that risk. So, but we all got to do it, and I'm glad you did. I also appreciate you sharing your story with our folks, Dan. Anything else?
Well, I think people just need to seek out information to give them a stronger peace of mind, really in any aspects of life, financially, spiritually, physically, with your body appearance, and also physically with what's inside. And it's what's inside that's the unknown. And once you can connect yourself with a knowledgeable resource that has some proven results, a proven track record, slowly things start to become uncovered. You learn new things. And I will never forget when you and Dr. Wright told me yesterday that I had a happy heart muscle. I wrote it down in my notes. I shared that with my wife last night. And, that was cause for celebration because, being the tall, thin guy with heart problems, it's just not expected. But getting a handle on that and then making course corrections and then maintaining and then monitoring what's being done and then adjusting again. And, I'm just in a really, really great spot at this age and this point in my life. And I really appreciate the expertise that you and Dr. Wright have afforded to me. And I'm singing your praises to people that I know. So maybe you're almost famous.
Well, we certainly do appreciate that. Do you mind if I explain that comment about the labs?
No,
the detail
please,
on that?
Please, we can go into some detail.
Okay, so one of the references was to HS troponin, and a related one was the happy heart test. And yes, basically what we're doing is looking to see if there's any significant strain to the muscle or loss of cardiovascular access. Another key component that Dan had was Lp(a). And as we got a little bit deeper, that was something that he was not aware of. His docs had not been looking for that. Dan got started on some niacin and had the reaction we usually get and we usually expect. With niacin, you get a 20 to 30% decrease in Lp(a), and that's what we want. For those of you who are not familiar with Lp(a), we've got about half a dozen videos on it. You may remember the name Bob Harper. I've got a video called LP Little A, Is It Ready for Prime Time? And the message was with Bob Harper's heart attack hitting the news and then him coming out a week later and saying, yep, I think he's on the Biggest Loser show. He's a well-known fitness and health coach and looks like he's in his 50s. I'm not sure how old he is, but it was a big surprise. Happened maybe 18, 24 months ago. Within a week or so of having the heart attack, he came out and said, guys, I've got LP little a. And didn't get much deeper in terms of the details behind there. But LP little a is it's a genetic component of LDL. What other people have called the bad cholesterol. It's some of us make it as, most of us make some LP little a. It's very common to see a significant amount. Given what I do, you might imagine I do see some world-class level LP little a activities. I've got some patients. There's a French-Canadian gene pool that tends to have levels up around 500 and more. Now, folks like that will often have aortic calcification. But again, it's similar to the situation with FH, hypercholesterolemia. It's another genetic variation in terms of LDL. There are about 2,000 different SNPs or genetic variations associated with familial hypercholesterolemia. Some of them cause the person to make more LDL. Others, most of them, are variations which cause people to not make as much or not dissolve or metabolize that LDL as much. Bottom line is, like LP little a, FH, they do increase risk, but the bigger risks happen to be when they actually decrease your reserves. In other words, some of those patients really they're fine until they start getting in their 50s and 60s and start developing some challenges with insulin resistance. And then they just don't have the reserves to push back with two risk factors like that. So again, thank you so much, Dan, for sharing that part of the story.
My pleasure, Dr. Brewer.
Glad to see that you'll be having a little bit better mental health and less stress.